Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Khan, non-stop show 868th episode. Let's have the headlines of the day. India is seeing a decline in COVID 19 cases with 865 active COVID cases in the last 24 hours. The daily positivity rate stands at 0.64%, while the weekly positivity slowed down to 0.81%. Study claims 50% of women in India between 30 to 49 years of age suffer from abdominal obesity. In its latest guidelines for weight loss, the WHO recommends against the use of NSS to control body weight or reduce the risk of non communicable diseases as per an official statement. Researchers from German Cancer Research Center have uncovered new evidence that daily intake of vitamin D could help reduce cancer death risk by about 12%. Breast milk from parents following a vegan diet has been found to contain two crucial nutrients, carnitine and vitamin B2, according to a recent study. So let's go to the topic of the day. The topic today is an overview of problems with the decreased desire to have sex, especially amongst the females. So, for this, we are having Dr. C. Sharat Kumar with us. Let me introduce Dr. C. Sharat Kumar. He heads the post of principal, professor, and head of the Department of Reproductive Medicine and Surgery at the esteemed Mediwave Institute of Medical Sciences in Mysore. With an impressive track record in education, he has achieved remarkable success. He serves as a mentor to numerous students and has led the institute to new levels of achievement. Now, let's talk about hypoactive sexual desire disorder amongst the female and how it affects so many people. Welcome, Dr. Sharat Kumar. So, Dr. Sharat, today we are talking about this very important topic, which is almost a taboo amongst the society of Indians because we don't like to talk about it.
Yes, ma'am.
So, to begin with, let me ask you, what is hypoactive sexual desire disorder and how does it differ from a temporary decrease in sexual desire?
Very nice, madam. So excellent question to start with. See, the definition of HSDD, that is hypoactive sexual desire disorder, has changed several times from past 50 years. Right from 1970, when Master and Johnson's introduced this human sexual cycle, they were the first people to say that there is disorder in the women also. Till then, everybody was thinking that the sexual dysfunction was really in the men. But it was earlier diagnosed and it was earlier said that it is sexual arousal disorder. Then it was named as frigidity. Then it was named as female impotency. And ultimately in DSM-5 in 2015, it was labeled as hypoactive sexual desire disorder. There is lack of interest. In common terms, if we can say, the lady doesn't have any interest in the sexual activity. So that may be again depends upon the types of the sexual disorder. That is, it could be lifelong HSDD or the acquired one. Lifelong sexual disorder is right from the beginning of our sexual life, say from the age of 13 or 14 till today. She never gets any arousal or interest in the sexual activity. That is called as 100% frigidity. That is no interest in the sex at all. That is lifelong. Acquired one is till recently, say from 6 months, she is not feeling that good. Earlier, she was enjoying the sex, she was sexually active, arousal was there, excitement was there, desire was there. Now, from say past 6 months or 1 year, she is not having that desire or arousal or interest or excitement during the sex. That is acquired one. And again, it can be two types. One may be situational. That is, in particular situation, the lady doesn't get aroused. Or it could be interpersonal relationship. That is, with a particular person, the lady doesn't get excitement. With another person, she may be perfectly okay. For example, a married lady with husband, she may not be comfortable. With her lover, she may be excited and she may be looking forward for the sex, and vice versa also. So, and also, yeah, the place, that is the environmental factor, situational. In the bedroom, she may be perfectly okay. But when they go outside in some other room or in-laws house or in a room in a hotel, she may not be comfortable because she may feel insecure there. So it is situational or environmental or the temporary factor or interpersonal relationship or the lifelong. In interpersonal relationship also, with a given person, she may be comfortable and at some times may not be comfortable at other times. For example, during menstrual cycle, she may be very uncomfortable, she may reject, she may not get the desire. And when there are children around, she may feel uncomfortable and there may not be any interest in sex at all. With the same person, when they are only two, when they go for an honeymoon or a package tour, she may enjoy the sex like anything. So, environmental factors, social factors, house factor, in-laws, the children, those factors, all they come into the picture. So, HSDD is not a simple thing. It is a very complex situation, especially in the Indian women. There are a lot of other problems. For example, children. When there are children, small children, she will be more worried about sending them to the school, preparing them the food and other things rather than the sex. And even in the night, she will be so much tired doing all the housework. She may not be comfortable in the bed. So she may lose the interest in the sex because of her stress, because of the overload burden in the from the house factor. So relationship, when there are in-laws, when there are people around them, she may be uncomfortable. She may think noise will be there because most of the in Indian scenario, the rooms are small, houses are small. Many times they have to share the room with other adults. So she'll be worried about the sound, noise. So the desire will not be there. She will not initiate the sex at all. So Indian scenario is entirely different. It is very complex. And also religion. Certain religions doesn't allow these women to practice sex freely because in-laws will be watching. So they should be always worried about what others will think, what brother-in-law will think, what other will sister-in-law will think, what father-in-law will think, mother-in-law will be thinking. So her mind will be always towards others watching her. So she doesn't want to get into this one and get labeled as a sexy lady or something like that. So Indian scenario is slightly different and cultural practice. Many in Indian society, in many of the castes, the sex itself is seen as a taboo even today, especially in the village circumstances. Already there will be only one room where all will be sleeping, and again a sex taboo. During intercourse, she has to totally lie down separately, sleep separately, even sometimes outside the house also. It's very, very miserable, pathetic situation. So how can she get the mood? In fact, during the menstrual cycle, it is the best time to enjoy the sex because the hormones will be very nice and there is no problem of becoming pregnant. But still, the taboo is no, don't touch her. And these are all the limitations in the Indian scenario, madam.
Right.
In old,
So
madam.
you have told me what are the common contributing causes that lead
Yeah,
to this problem in a woman. Can you
yeah,
explain the symptoms that women might experience? Besides the desire is gone, and how
yeah.
can someone recognize that they are suffering from this condition?
Yeah, signs and symptoms are that she tries to be irritative in nature during the sexual activity. If the partner comes and asks for the sex, she may refuse. She may get the irritating, and she may pretend she has got headache, body ache, something like that, and she may give hundreds of reasons for not having the sex. She may say that she has got periods, though she may not having the periods, and she may say there are in-laws and others watching, noise is there, that this. So signs and symptoms are irritating and depressions and anxiety, or these are all the signs and symptoms of HSDD. And not satisfied, that is, she will not be satisfied with what's happening, and she may raise objections for even minute things, and get into a quarrel so that she can avoid the sex. So for a silly reason, her actual reason is to avoid sex, but she may start a small quarrel. Why you didn't bring that vegetable I told? Why you didn't bring that fruit? I told you, like that. So that quarrel ultimately leads to the sleeping separately. So these are all the signs and symptoms of the lady who is suffering from HSDD. So to avoid, she pretends as though she has got backache, knee pain, headache, and even she may pretend as having nausea or vomiting, like that. And she ultimately avoids the partner to engage into the sexual activity.
So, can you tell us that in women in certain age groups, is it
Yeah.
more common or it can happen in any age group?
Yeah, as the age advances, the sexual activity comes down both in men and women. The sexual activity is maximum in ladies between the age of 18 to say 40. So this is the peak. In fact, she will be at peak in 40s. So after 40s, there will be decline in the sexuality because the estrogen level comes down. In the perimenopausal and premenopausal age, she will getting other premenopausal syndromes. So she will be more bothered about all those problems. In the postmenopausal era also, because estrogen will come down, the vagina will become dry, there will be no lubrication, there will be a lot of other arthritis problem and joint problems, bone problems due to osteoporosis, and due to low estrogen she loses the interest also. So as the age advances, she loses the sexual interest, but the peak will be in 30s. For example, between 18 and 30, most of the Indian couples will have intercourse almost daily, or at least alternate days, or at least two times a week. From 30s to 40s, the woman starts avoiding because her preoccupation, she will be more occupied with housework. She will be a most of the times a a housekeeping lady. She will be more worried about keeping the house tidy and this one, and sending the children to the this one. And if she is a working woman, again the problem will start. She has to manage the house. She is a housewife come working lady. She has to, time management is very difficult. She'll be tired, so she starts avoiding the sex after 30s. So it will be settled down for a weekly once, or even sometimes 15 days once. After 40 again, she loses the interest because of premenopausal syndrome, PMS syndrome, postmenopausal syndromes after 45 to 52. And again, done. And by that time, she would have developed other problems, medical problems like hypertension, diabetes, obesity. All these contribute for HSDD because directly or indirectly, general health plays a major role in the sexual activity, and her priorities will change. Taking lot of medicines like antihypertensives, antidepressants, and anti-anxiolytic drugs, and even antihypertensives, they all cause HSDD because they all reduce the estrogen level in the body, and sometimes they reduce the little testosterone. So testosterone is also required by the woman. That will also come down. And body problem, body dysmorphic syndrome, that is, she would have lost her what charm she had. So she starts thinking herself that she is not attractive, the husband or the partner is not attracted towards me, I have lost his shape, I have become obese, like that. And she might have even developed other diseases, thyroid problems, or even cancer, or dental problems, or the uterine, or the problems of the cervix. All these will avoid her to engage in the sex as the age advances. And as the age advances, as everybody knows, the general health also decreases, body shape also changes. All these add to the this one. And also the initiation from the partner will also decrease. What the husband would have been looking at the age of 25 or 80, he will be eagerly coming to house to have a sex with her lover and partner. The same thing will not be there. The husband will never turn up at the age of 50 or 60. He will be more engaged in the club activity, in playing the cards, and he comes drunkard. And at that time, absolutely, there will be no mood for the female partner also. So the male partner's role plays an important role. And if the male partner develops the sexual dysfunction like erectile dysfunction, premature ejaculation, then automatically the female will also lose the interest, because there will be no arousal from the male partner. Because in Indian scenario, most of the times it is the male partner who initiates the sex. Rarely we see the ladies initiating the sex. So if the male partner loses the interest, automatically the lady will land up in HSDD, because it is a relative HSDD, not an absolute HSDD.
So
Over
you
to you, madam.
told us about the woman's overall quality of life, which will go down.
Yeah, yes,
But
yes, ma'am. Yes,
besides that, there are certain medical, positive effects of
yes,
sex which they don't
yes,
know. Now women are coming forward
yes,
and
yes,
attending clinics to find out more about their
yes,
sex needs
yes,
and how to go about it. So, can you
yes.
tell us how sex helps a person, a woman, in staying fit?
Yes, ma'am. It's an excellent question. The sex plays a major role in the interpersonal relationship, because a good sex in the night, next day, both the partners will be cheerful. They will start enjoying. They'll be looking forward to have more and more interactions and cheerful. The whole day will be excellent for them, because both will be happy. Because during sex, lot of the hormones, that is good hormones, that is the dopamine, oxytocin, they are all released. They are all good neurotransmitters for well-being. So for well-being, these hormones are required, and these hormones are released only during the sex. So the wellness, the fitness, because of the exercise during the sex, the body becomes fit, and the well-being will be there. And because they during sex, there will be a lot of physical attraction. So both will think that, yes, I am required by him, yes, I am required by her. So that positive attitudes brings the interpersonal relationship. In fact, there is a one proverb in the Indian language, especially in Kannada also. All the problems will be in between the couple will be till the bedtime only. So most of the problems will be, whatever the quarrel will be settled down in the bed, because during the sex they forget about that one. They start a new life. Whatever had happened previous day, they will forget. So good sex life is very, very important, from not only from the interpersonal relationship, but also from the body point, because the hormones, that is the well-being hormones, the neurotransmitters, the oxytocin, the other hormones, the prolactin, serotonin, they are all released to the maximum extent. And also even thyroid hormones, they come to the peak. Estrogen also comes to the peak. There will be complete reverberation of the entire body. Entire body shakes, so that it gets a new energy. They will be even looking younger. Those ladies who engage in regular sex look younger than the same ladies who doesn't have sex during the same lifetime, the same age group.
Are there any myths or misconceptions about this condition which you can clear for us?
Yes, madam, especially in the Indian scenario, if the lady is sexually more active, there is a myth that the others will misunderstand her. So that myth should go. She should start taking active role, 50-50 role in all the sexual activity. And in most of the problems, especially since I'm an infertility specialist, whenever they come, usually the first question I ask them is whether your sex life is okay or not. Because I have seen so many cases of unconsummated marriage coming for infertility, landing up even in IVFs also. When we go into the details, they accept that the marriage itself is not consummated, because the semen quality is excellent, the pelvic scanning of the lady is perfect, the tubes are perfect. Why she has not conceived? So 5 to 10% of the unexplained infertility, if you go into the details, if you ask the history, you will get the answer, because they will not be having intercourse at all. Even if they have got the intercourse, it is very rarely. So once in a blue moon, that will add to the infertility itself. Hence, it is very, very important to talk about the sex with especially the gynecologists, especially since most of the gynecologists are ladies. Whenever a lady comes for any other problem, just ask her the sex life also. It's very, very important. Little changes in the lifestyle modification can improve their sex life, like diet, exercise, losing the weight, keeping her body fit, changing their costumes, looking more adorable looks, changing their dress, especially the nighties. So if the wife looks attractive during the night, the husband will get actually more attraction, and the sex life will be better. I have seen most of the times once the lady gives birth to one or two children, she loses the interest. She stops putting the lipstick. She stops wearing the lingeries. She stops wearing the sexy outfits. So what happens is the husband, the partner, loses the interest. So to keep up the interest, one should arrange the bedroom like the first night. Every night should be the first night for the couple. So have the perfume, have the bed prepared, keep some flowers in this one, some essence in the bedroom, and soft music, a sexy video, and all this adds to the glamour of the bedroom. So it is important that the lady keeps the husband happy at all the times, so that the husband should be coming to the house as if he is coming every time for the first night. So that should be the scenario. That attitude towards the sex should change, and they should change the attitude that yes, I am aged, why should I have this sex? I am already 40, why should I have this sex? So all these things should change, because sex, as far as the sex is concerned, is a lifetime. Even sex can be done at even 70s and 80s also. I have read, I have seen the movies also, where even the couple of 80s, even the 90s, they have their own, at least cuddling, kissing, at least caressing the body. All those foreplay are very, very important to have the neurotransmitters released, oxytocin released, and to see that the body will be always in the perfect mood. That is joyous mood. That is for the wellness mood.
So the partner can support the female by
Yes.
initiating in all ages and the
Yeah.
cuddling, all these things you are
Yeah,
suggesting.
yeah, yeah,
Yeah.
yeah. Very, very important. From the male partner, from the lover or the husband, is that he should initiate the sex in such a way that foreplay plays a very, very important role. Most of the hyposexual desire disorders are due to lack of foreplay, lack of initiativeness from the partner. Who has to arouse? Who has to make her excited? Who has to make her desirable? It is the male partner. So you can see the animals, the instinct, how the animals go and cuddle the female partner, so that the female partner comes into the this one. Same thing should happen from the male partner also. And he should be very supportive. If there are some problems in this family, financial problem or other problems, he should try to settle down, so that the lady gets into the mood and try to fulfill her ambitions. Her ambitions may be very minor. She might have asked her to bring some flowers to the house, or she might have asked her some vegetables or fruits. If the husband forgets and goes, that night is gone, because she becomes so wild. And I have seen the male partner forgetting the wedding anniversary, forgetting the birthday of the lady. What will happen to her? She thinks that yes, this fellow earlier for first 10 years of married life used to take me and get me the jewels during my birthday, get me new saris. Now is not interested. This husband, what has happened, is extremely busy. He may be a software engineer, he may be already a top management specialist, he may be a general manager. He has no time to spend for the wife. That is very, very disastrous. So initiation should come from the male partner. He should always enter the bedroom as if he is entering in the first night, so that every day should be a first night, so that the couple will always enjoy this sex. That will keep them very, very happy.
So you told us so many lifestyle changes and let's say therapies which they can
Yeah.
do to enjoy this. But are there any medical treatments also
Yeah,
for
yeah.
this
Hey,
particular
it's a
thing?
very good question, madam. See, there are two types of treatments. One, non-pharmaceutical treatment, which most of the things I have told: lifestyle modification, diet, exercise, keeping the body fit, keeping good costumes, good sexy night lingeries during the night, sexy transparent night gown, so that she gets attracted to the male partner. That is one thing, lifestyle modification. And secondly, good diet, more of vegetables, more of fruits, less of fat. And third thing is yoga, exercise, walking or jogging, skipping something. And the next one is the other non-pharmaceutical agents like vibrator, okay, vaginal vibrator, or vacuum pump device, that is a clitoral vacuum pump device. They can initiate the arousal, because the lubrication would have been lost, especially in the perimenopausal age and menopausal age. The natural estrogen has come down, so it is the artificially we have to stimulate her. So using a good vaginal vibrator makes her the clitoris enlarged, so that there will be lubrication and arousal will automatically come. So using sex aids like dildos or vibrators, or even gel, the lubricant gel and estrogen gel, it all they all help. These are all non-pharmaceutical. This one. And again, counseling. If there is really serious HSDD, counseling with a sex therapist or a sexologist or a good gynecologist or a good andrologist who is has got experience in counseling the couple, sex therapy for the couple, will remove all the myths amongst them and make them to feel newly married couple and start enjoying the new sex life. So that should be done by a good sex therapist. Sex therapist need not be a sex counselor only. Even a gynecologist can herself become a sex therapist by adopting this into her daily practice life. So apart from this, the non-pharmaceutical treatments, there is and apart from that, psychotherapy is also there if the extreme cases of HSDD are there. And pharmaceutical agents, there are several pharmaceutical agents available in the market, but none of them have been proved beyond doubt. They all help, but they themselves will not go and make her to arouse and excite. So the one of the most important pharmaceutical is this flinasterin in tablet, that is flibanserin, that is it's available as ideal tablet, but it is not, it's freely available in the Indian market. You have to get it through some importer. It is costing very highly, 200 rupees per tablet. That is the trade name is ID. Flibanserin is the chemical name. It is an serotonin inhibitor. It acts as a neurotransmitter, inhibits the serotonin. Serotonin is one which inhibits the sex. So this goes and blocks the receptors of the serotonin and initiate the excitement in the lady. But this one is not all the ladies get the excitement. They work only in the premenopausal age only. Postmenopausal age it won't work because the estrogen has already stopped. So this flibanserin, the trade name is Adil. It is not freely available in our country. You have to get it through some agent only. It is available in most of the mega cities in Bangalore, Pune, Bombay. But you have to catch hold of a pharmacy company and get it. It's an imported drug. The Drug Controller Authority of India has not yet given license for this medicine to be manufactured in India. Other than that, other drugs like bupropion, bispirion are also available. They are all anti-anxiolytic agents and antidepressants. They help to some certain extent if they have got anxiety and other disorders, depression disorders. Apart from antidepressant and anti-anxiolytic action, they have got also stimulating actions. These bispirion and bupropion, they can be used. And other available in the market, these adjuvants, that is the zinc, selenium, then other L-arginine, L-carnitine, they do help to certain extent. And also even the sildenafil citrate, tadalafil, even testosterone gel, they all help, but they themselves they will not do unless the lady herself takes the initiative. The medicines themselves they will not go and because the brain is the biggest organ of the sex, it should come from the brain, not from the drugs. So she has to make up her mind, yes, I will live it a good sex life, then only these medicines help. Otherwise, just applying testosterone gel on a lady, she herself shall not get the mood, oh, I want sex. No, it won't help. They're all adjuncts. They have to be taken with a pinch of salt only. So we cannot say that this will work. But after counseling, these two drugs help because they work as placebos, and the vitamins, minerals, zinc, selenium, all of them they work. But provided counseling is also done and the lady accepts it. Once the lady accepts it, even a placebo will work because she thinks, yes, I have taken a drug to get the excitement. So even 25 milligrams of sildenafil citrate or 5 mg of tadalafil can be given. And estrogen gel can be applied, and estrogen tablets can be inserted into the vagina. Even 25 milligram of sildenafil absorbable tablet, that is Penegra Express, is available. That is absorbable one that can be inserted into the vagina. That gives the little erection to the clitoris, just like a vasodilator, just like erection to the penis, it gives erection to the clitoris. So stimulation will be easy. And the other gels, that is which can lubricate the vagina, make the vagina moist, like V gel or water based gels, they also work as certain sort of stimulants. The best one I bet is the vibrator. An excellent dildo vibrator with magnetic head gives fantastic pleasure to the lady. Once she starts enjoying the pleasure of the vibrator, she starts masturbating. Once she starts masturbating, lot of the oxytocin and other neurotransmitters are released. She'll be ready for a sex. So before the husband comes, if she can stimulate herself with a good vibrator, nothing like that. She's already moist, she's wet, she's ready for receiving the penis.
So the take home message of today's talk would be that ladies, you have to get up, and if you are
Yes,
not feeling up to it, you can consult a doctor. You can go online with the help groups, and
yeah,
first that need has to come from inside you, and then the
yeah.
doctor can,
See, there
right?
should be arousal. She should now. The modern lady is totally different. She has come out of everything. She has come out of her home. She is in the peak in the software industry. She is peak in the nursing industry, and in the medical colleges, the entries are more than 70% women are there. In nursing colleges, more than 90% women are there. In teaching cadre, in the teachers, 80% are women, and even in the software industry, 10 to 30 to 40% are women. So we have got the liberation. So that liberation should not be limited only for the work, it should be on the bed also. And a good housewife who keeps her husband happy, she will not lose that husband. The husband will not go elsewhere. She will not have any extramarital affair. Otherwise, the one message I would like to give is, if you don't satisfy your partner, he may slip out of you. Be careful. So keep her happy. By keeping him happy, you'll also be happy. The entire family will be happy, and you start looking younger by having better sex and better image. And keep an eye on all your personal belongings, your lips, your hairs, your body, your style, so that that itself is will give a better image, sexual image, so that you can be more attractive and more satisfying to your partner.
Thank you, Dr. Sharath, for joining us today. Could you show us the certificate, please?
Oh, nice.
So that was a nice talk show
Nice.
today.
Very nice, madam. You made my job easy by putting wonderful questions, and it went so smoothly that as if I am showing the slides you started. Of course, we have not discussed earlier which questions you'll be asking. It was all impromptu, but it came so nicely as if both of us we already prepared. The listeners will be thinking that Anita Kant has already given the questionnaires to me and we have answered. So nice. The understanding is perfect. I sincerely thank the IJCB people, MidTalk people for giving wonderful opportunity for expressing, and our chairperson Anita Kant is super. She takes us so easily, smoothly. Yeah. Thank you very much, madam.
Thank you so much. That will be all for today. Dr. KK Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK's Med Talks. Namaskar.
Namaskar. Good night. Have a nice, good bedtime.